Hi, I'm Mike Dilk and you're listening to the Relax Back UK show, a show that explores all kinds of health topics relevant to you, your family and your friends. Each week I talk to expert guests from a range of backgrounds to inform and entertain you. So please do join the Relax Back UK family and stay tuned.
Hi, and thank you for joining me on the Relax Back UK show. My guest today goes by the name of Dr. Mo, and he's managed to do something that many others have tried and failed. He has created a system that can get all our health info that is scattered in various systems around the country, possibly even the world, in one place.
It's a lot of work behind the scenes, so it's obviously what people want. It's a simple thing to describe. I've got my health. There's data about it, put it in one place, get on with it. Yeah. But the places that it comes from are so fragmented and different, and the legalities and technicalities of bringing you the data from every place are so complicated. So that's the hard slog.
This has taken him 17 years so far, and having all your health data in one place is obviously a good idea to help with things now, but we also spent time talking about how this data can be used to our advantage and how things might develop in the future.
And then there's smartphone apps where if you put your finger on the camera, it can pick up problems with your heartbeat. And I'm already seeing some of the new apps that are testing out the camera looking at your face can measure your hemoglobin and cholesterol. That hasn't been certified yet, but you can see where the technology is going, right? So this stuff is really powerful to capture.
So please do stay tuned for a fabulously interesting show. Thank you.
This show is cool!
Dr. Mo's first name is actually Mohammed, and I had to start the interview by actually admitting that I'd forgotten his last name since the last time we spoke.
So Al-Ubaydli, but as a James Bond fan, I'm very happy with Dr. Mo. So
okay, we'll run with Dr. Mo. That's good. Dr. Mo, he's the founder and CEO of Patients Know Best, and that's a platform which links patients to their personal health records that are, well, wherever they may be. And for a long time, I think people have thought that this was actually impossible. And now you have really achieved the impossible, and you've made a system that does link NHS records, but we might talk about this, potentially records sort of worldwide, but certainly NHS health records together in one place. And this has been a gargantuan task, but you've done it. So I've really got to say, what possessed you, what motivated you to try and sort this problem out? Because I think other people have tried and just sort of given up. And how did you manage it?
Doctor who diagnosed and treated my rare illness, they saved my life. But also the nurse who taught me how to inject myself, she gave me a life. She made me independent. It was amazing. So when I was in the States writing a book about people getting their medical records, I could just remember the gift that Helen, that nurse, had given me. And I thought, your medical records is another gift. It's something we could give to millions of people. So that's what got me started. But what I've discovered is with everyone who've hired at PKB is that often after they join, they tell me a story about their own health or the health of someone they love. And they've had a first-hand experience of how disjointed the healthcare system is and how surprising or annoying that it's still true to this day and age. And they're frustrated and they want to fix this. The technology is here. It just hasn't yet happened. And everyone on the team is annoyed and trying to fix that. And
everyone's got a story, actually. I'm thinking I have. Other members of my family have. Yeah, absolutely. Yeah, good point. So how long ago was it that you started to roll up your sleeves and say, right, I've had enough of this. I'm going to fix this?
We started July 23rd, 2008. So just over 17 years ago.
Okay, so this is, and this, goodness me, this has been quite a long haul.
Yes, I have photographic evidence that I used to have hair in 2008. It's been a long haul.
Good. Anyway, well, congratulations for making it this far and essentially doing it. And since we last spoke, I thought, right, I better have a go at this because Mo spent many years trying to sort this out. So, well, actually, before we get into that, perhaps it's worth just describing a little bit in terms of the layman what it is that you have created, apart
Yes,
from
of course.
just how it kind of works, sort of where
Yes,
it
it's
sits in the
a
whole thing.
website called patientsknowbest.com. And if you go to patientsknowbest.com/register like you did and you live in England, you enter your NHS login like you use for your COVID passports. And then it asks, can I get your GP data? You say yes. And we pull all your GP record. And then also in parallel, we may have some other information about you from hospitals that we've been working with for the last 17 years. So you'll see that as you log in as well. And then you can connect your Fitbit, your Strava, and add anything that you want. And in about half the country, you can also see it in the NHS app as well as on the web. But that's what it is. It's a website that has a place for all of your information and grabs as much in advance of it for you automatically.
Right. It described like that, it sounds very simple, but the actual sucking of information out of the NHS is the hard bit, isn't it?
It's a lot of work behind the scenes. So it's obviously what people want. It's a simple thing to describe. I've got my health. There's data about it. Put it in one place. Get on with it.
Yeah.
But the places that it comes from are so fragmented and different. And the legalities and technicalities of bringing you the data from every place are so complicated. So that's the hard slog.
Good. Right. Well, anyway, after we last spoke, I thought, right, Mo's worked very hard, spending me years doing this. The least I can do is sign up and give it a go. So that's exactly what I did. And it was dead easy to do. So I logged on. And then I thought, all right, well, let's just have a look at it. Let's see what it knows about me, see what it can find out about me. And so the first thing I looked at, because there's a section that you can click on for your medicines. So I take medicines every day as do millions of people really, for high blood pressure and cholesterol. So, I'm a 59-year-old bloke, pretty normal. So I thought, right, has it been able to find that out about me? So I clicked on that and they were there, So I thought, all right, that's good. I can see what I'm taking, but actually I know what I'm taking. And because I take them every day, so I don't, that's sort of one I don't forget. Mind you, if someone asked me the exact name and how many milligrams, I might falter a bit then. So I could look up and find that. But then I started to think, all right, it might be other medication that is, just supposing I was in an accident or I fainted somewhere and I was taken into A&E. The first thing, maybe not the first thing, one of the important things that any doctor that's looking at me is probably going to be, is he on any medication? Perhaps he forgot to take the medication and that's why he's fainted or what have you. So can anyone, if this happens to me, can a doctor check and see quickly what meds Mike Dilk is taking now?
I'm really pleased you did this, by the way, Mike. You're a man of action. I remember one patient telling me 10 years ago that having PKB is the first time he felt safe enough to go on holiday. Because he had his record with him and he can go to, if he went to A&E, he could show the doctor everything. By the way, he went to Australia. I would have stuck with France as my first trip, but he had a nice holiday. Anyway, so in answer to your question, yes, you can give anyone access to your record, and that means your doctor, your family members, and so on. I recommend you give your family members access because when you make that A&E visit, you may not be able to log into your account, but your partner might be, for example. They're the ones helping you out. Now, the doctor can definitely see it if you show them your phone, and you can definitely give them access by entering their email address. But normally, most doctors either won't give you their email address, or at the moment that you need them to see it, time is of the essence, and people just show their phone.
Right. Okay. So you've kind of got to be. You can't have fainted. It's not just an automatic thing that any doctor can dial in and see your stuff.
So about a quarter of the UK's hospitals use this, and so they do get automatic access when you go to the hospital.
Okay.
But that's because they're working with us as customers, and that takes a while to line up. But if you're one of the other hospitals or if you go abroad, you or somebody around you has to be competent and conscious enough to do it for you.
I get it. Okay, no, I understand. All right, so and I've got another little example to just run by you. I'm actually pretty fortunate. Okay, I don't often have to go to the doctor or the hospital. I mean, it does happen occasionally. But a couple of months ago, I was extremely stupid and I fell off a ladder. And
what were you doing, Dad?
I was making a greenhouse, actually. I decided to make a greenhouse.
Making a greenhouse?
Out of old trash I found, old windows and old glass doors. And I was putting them all together. And I was nearly finished. And I was very proud of myself. And I was just getting a bit too cocky. But anyway, that's not the point of the story. The point of the story is
your interview. Go ahead, Mike. Sorry.
The point of the story is I fell off the ladder. And I went to the GP and saw a physio. All very efficient, by the way. People complain about GPs and that sort of thing. But anyway, the service I got was brilliant. And this was a while ago. And I thought, I wonder if I can see what happened here on the system. So I could see the fact that I'd visited. And this was a couple of months ago. And I thought, right, let's update it. Because I could still feel the issues with my shoulder, actually. So I thought, right, I'll just update it and say, Mike is still in pain, but it's kind of getting better. Not too worried about it, something like that. But I couldn't add anything to this. And I got the message, essentially, I think you can't add anything to this because the practice or the GP doesn't have messaging enabled. So my thought was, okay, are you getting buy-in from the NHS? Because presumably someone in the NHS has to go, yeah, that's all right. I'm happy to see whatever Mike is updating and that sort of thing. And then I thought, if I was a very busy doctor or physio in the NHS and I get something saying, why don't you just enable this message so you can be bombarded with even more stuff? Because these people are not twiddling their thumbs. I might just kind of say, well, no. So the question really is, I suppose, are you getting buy-in from GPs and people? Or do they just see it as more work?
Well, just first one quick one. You can add how you are in the journal page. And you can fill out your symptoms and you can connect your device with measurements and so on. But that particular message you can't reply to because, like you're saying, your GP isn't bought into it. So some parts of the NHS are really bought in. One of my colleagues, her aunt is in hospital in London, and the aunt gave her brother access. He's a doctor in Australia, and he sees her test results from Australia before the London doctor even knows they're back from the lab. And he's in there checking and telling her questions to ask the doctors on the ward round. Now, for that customer, that hospital is obviously, it's the right thing to do morally. It's your body, it's your data. But it's also really useful to the hospital when the patient understands their health and when the family understand what's happening, what to do about it. But to go wider, though, I'll just tell you a secret, Mike. So you, as the patient, you're our path to the hearts and minds of the NHS staff, right? So my job is to build software that trains you to be the most useful patient to your doctors and nurses. We'll give you all the information about your health and all the understanding, do a bunch of work to look after yourself. And then for the bits you need help from your clinical team, I want it to be that they can't believe how much you've already done yourself. And then they wouldn't think, this is a waste of time, volumes of messages. It's actually, when Mike sends me a message, it's for something really important. And I definitely want to pay attention to it, and I definitely want to make it easy for Mike to do that.
Okay. So the idea is it makes it easier for everyone in the NHS because all the information is there. They're not going to run around looking for things, and the patient is on top of things, essentially.
Yes. Okay. We want a patient who knows best. We want to make you a patient who knows everything, knows what to do about it, and comes in for the extra bit of help. Yeah. But many of the doctors misinterpret the name as it's saying patients do know everything and they're going to get a bunch of know-it-alls telling them they're wrong and so on, which is not what we're doing. Yeah. But that's another road that we're going on.
Okay. Doing this made me think, all right, so if one particular doctor in the practice that I go to clicks, okay, messaging enabled,
yes,
that's fair enough. But it's a busy practice. If I make an appointment at my GP, I rarely see the same guy
yes.
Twice because, I mean, some people do because they specifically ask for that, but it doesn't worry me who I see. So is it possible to kind of get a whole practice to message enable?
Yeah, and that's what we do with the customers. And the way they do it is you don't message your GP directly. You message a team of first line people. That might be receptionists, it might be assistants. They then escalate it to the nurse. The nurse can escalate to the GP and so on. But there's definitely a way to invite the whole practice, but only if PKB has a direct relationship with that practice.
Sure. Okay, so you've got to chat to all the GP practices in the land, of which, well, I can't imagine.
There's only 6,000, Mike. So how hard can it be?
Okay, that could take a while.
It's different ways to get there. They are organised in 42 regions, and so we try and go directly at that level.
Right. Okay. Interesting. I thought of another question. These are quite detailed questions, but it's things that I've been through. So I kind of hope this is okay. When you go for a blood test, it could be about anything. It could be a cholesterol check, or I know prostate cancer check, or this kind of thing. In my experience, you go for the blood test, and actually the local hospital has just recently reorganised this, so it's extremely efficient. You go park your car, you get half an hour free parking, you have a time slot, and usually you're back within the half an hour.
Yes.
Very efficient. But the bit that I always surprises me is you don't hear anything back unless something's quite wrong. They call you and say,
yes,
can you please come in like now, this afternoon?
Yes.
And so I must admit, I can't remember since I signed up if I've had any blood tests or not. I don't think so. But I went to go and check and nothing came up. But will this system, will you automatically see those results when they appear? And is that easy to make happen? I would imagine it really should be.
So I remember this patient with HIV, Paul. Now he had this London hospital, had just started working with patients in their best. And so all the results come in real time. So he immediately booked himself in for a blood test. 9 o'clock in the morning, he gave blood. 11 o'clock, he gets an email with his result. So he loved this, and he told all the other HIV patients about it because he ran a patient support charity. Now, when you describe the normal attitude of NHS, which is they don't tell you unless there's something wrong, 70% of HIV patients are stable. So that means they're well, medication the right dose, and the proof is the blood test. And many of them are working age. So if they can have their test results, they can avoid the hospital appointment. That means half a day off work gets avoided. And they know, or they can learn how to interpret the results, normal or abnormal. So at our customer sites, they send everything real time to you, rather than only telling you and calling you if it's abnormal.
Okay.
Now, in your case, you got your data from a GP surgery that's not yet using Patients Know Best. And at the start of next year, we'll show you the test results for anything the GP did. We've got your results already. We just haven't shown it to you properly in the system. But since we started this in May, we've had 1 billion test results coming already. So they're all there. We're just trying to figure out the best way to teach you what they mean. But most doctors initially believe that you should only know your test result if it's bad. And even if it's bad, they'll just say, something's bad, come in. They will never tell you the number. And that's what we've been trying to fix. So at our customer hospitals, you see everything immediately, and we start teaching you what it means.
Okay. I mean, presumably there's a reason why doctors do this. Are they just trying to stop people worrying without unnecessarily, or I don't know?
The way they've been trained is, first of all, obviously they've had lots of training and you've had none. So it's their job to know what the problem is. But then the other side of it is a lot of their training was very much, you have to be heroic and take responsibility. You have to know everything. You have to do everything, which is wrong and out of date. But that's where they come from.
Okay.
And so they think that if you look at the information you're going to get anxious and they want to get you anxious, and that you'll start Googling things and making mistakes, and then you'll make them anxious. So their default is to hang on to it and not tell you what it is.
Right. Okay. I mean, I can see that from their point of view, because people do worry unnecessarily about things, or they can do for sure.
Yeah, the first time you'll make a mistake, but there's a second time and onwards where it's really worth having taught you the first time.
Yeah.
But none of them was taught that that's how you work. From medical school, they were taught, no, the patient can never understand it. So, I mean, that's why in 2012, we began offering the system free of charge to medical schools, because the students were all being trained for a world where it's full of patients who are more like you. So you're quite engaged, you're paying attention, you look after your health. But most doctors aren't trained in that.
No.
So
Not expecting
the
that.
new generation, we focus on fixing on the source.
Yeah, interesting. Another thing that I noticed when I was going through the dashboard, and you know, it is relatively clear, so you can kind of see what's what. But there's one thing where makes use of where a lot of people have kind of fitness devices. You know, they monitor their exercise, monitor their sleep, and what they eat, all this kind of stuff. And there's a way of downloading this into the Patient Knows Best system for three particular types of device. Unfortunately, the one that I use, it's called a MazeFit. It wasn't there. But have you got plans to try and get more devices such that the information, a lot of information that people generate, can be put onto the system?
Yeah, definitely, yes. By the way, I read your book, which is fabulous. Am I right? You discovered your high blood pressure by accident?
Pretty much, yeah.
Okay. So people my age and your age, we should track our blood pressure. In Japan in the 1980s, this company called Omron, they tried to teach patients at home how to measure their blood pressure. Everyone said it was pointless. The numbers be wrong. Turns out the home measurement was more accurate than the doctor's one. Right? Why? Because when your doctor first measures your blood pressure, you get a bit stressed, you're a bit worried. So your pressure goes up and your doctor measures something falsely high. At home, you're more relaxed. It's more accurate. But also, the more measurements you collect, the more accurate the average is.
Yeah.
Your doctor doesn't have time to do lots of measurements, but you do, sat in the comfort of your home. So I'm a big fan of these devices, and they're getting better and better. But you're right, we haven't connected to anywhere near as many as I want to. We've focused on the harder bit of getting the data from the doctors, and then next year we'll get you a lot more devices that connect. And some of these are getting really amazing, by the way, the ones I'm seeing right now.
Yeah, I mean, they measure all kinds of things, and people that use them every day will generate a massive amount of data. I mean, it could swamp you, couldn't it?
So not swamp patients the best in terms of data is easy to cope with from a technical perspective, but a human looking at that data, like your doctor, what's your doctor going to do with your 6 months of sleep?
Yeah, actually, when I said swamp in that instance, I meant from the kind of physical storage of data, but it sounds like you're not worried about that.
No, that's our day job. We cope with this fine.
Okay. Yeah, no, but what you mentioned just then, I was thinking about this. Now, you've created a system that can get all our health info into one place. And I was thinking, well, from what you've just described, you know, it doesn't seem like the easy bit, but I was thinking perhaps actually that's the easy bit. The difficult bit is using all this in a meaningful way. Now, if you've got all the information there and you can interrogate the information so the doctor treating you can see, okay, what medication is he on at the minute because I'm going to have to operate on him or something like that. You know, that's obviously useful. But joining all the dots, you know, Mike Dilk fell off his ladder 2 months ago and today he's experiencing a headache and yesterday his blood pressure was a bit higher. You know, joining all these dots is potentially extremely useful, but no one's ever going to have the time to do it. I mean, you know, you need to have, each person will have to be allocated a doctor to look at it all, you know. obviously that can't happen, but my thought was it's potentially incredibly useful.
Yes.
But how can you kind of join all the dots and make use of all this wonderful information? Can you? Is it possible?
Definitely is. Look, I mean, your point about have you done the easy bit, and then there's the next bit. Every time we fix one problem, another three come up, So you have to enjoy all of these problems you're discovering and just enjoy this and solving them. So I'd say two things. First of all, the accuracy of these devices is getting better every day, right? There's already a research showing that a smartphone can pick up changes in your voice, from your conversations before a neurologist can diagnose you've got Parkinson's. And a phone in your pocket.
All right. So two things there. I'd never heard of that. And your voice can change a little bit when you get Parkinson's.
Correct. And also,
okay,
a phone in your pocket can pick up changes in how you walk also before a neurologist can diagnose Parkinson's.
Right.
So, and then there's smartphone apps where if you put your finger on the camera, it can pick up problems with your heartbeat. And I'm already seeing some of the new apps that are testing out the camera looking at your face can measure your hemoglobin and cholesterol. That hasn't been certified yet, but you can see where the technology is going, right? So this stuff is really powerful to capture. But then how do you analyze it, like you were saying? So I'm just going to say, big AI, but only in the sense that we can see the pace and direction of the improvement for analyzing this. So for people at home, that allows you to pick up problems sooner, which is great because the earlier you pick up the problem, the easier it is to stop it and solve it. But for the doctors, like you're saying, we can't have a doctor for every person. We need this automated analysis because the volume of data is overwhelming for a single person and who's looking after all these other people. But it's definitely coming, and it's amazing to be here as all these technologies arrive together and reinforce each other.
Right. And so are you working on that, or are other people working on that? That is another whole massive task.
Yeah, I'm helping the other boffins. So I'm getting them all the data. Other people are building the devices, and other people are building the intelligence on top of that.
This is so extraordinary. I mean, so I like to think I'm not that old. Okay, so I'm 59. But just, the advance in how you can be looked after in just a decade is just monumental. Like this is potentially going to change things enormously for patients. I would have thought. I would have hoped.
No, I'm all with you, Mike, and you will have many more years to come. But there's one quote I always go on from Bill Gates, which is people always overestimate what's going to happen in 2 years, but they underestimate what's going to happen in 10 years.
Right.
So the stuff that's coming, if you just look at the pace of what's come, it's accelerating. There's going to be way more useful things, not just cool, but genuinely changing the burden on the healthcare system and the outcomes for you as a patient at home.
Yeah. No, obviously that I think everyone should be able to see there's a massively useful side to this. Mm-hmm. Is there a downside? Is there a slightly scary side as well? Because, if you can pluck out of all this information that actually this particular person is going to get some particular disease and it's going to cut the length of his life by 15, 20 years, something like that, which is possible. Stuff like this might come out. Is that always good to know? Because I mean, lots of people might be interested in. Well, I'm thinking, kind of insurance company, medical insurance companies. Is it good for everybody to know this stuff or not? I don't know. Just chucking it out there.
No, so let's take examples, Mike. So one other data set that we're adding next year is the genetics, your genomic sequences, and the interesting thing about genetics is that it can tell you some probabilities about some things for you in the future. But some of the predictions it might make in some diseases are things that are really bad and you can't do anything about them. Mm-hmm. And so that's when people start saying, well, I'd rather not have known that advance. And that is one difficulty to manage, and different people react to it in different ways. So some of it is about knowing I'm a person who'd rather not know this kind of risk, or actually I'm a person who does like to plan around my life and I would like to know that risk. But that's one difficulty. And then you mentioned the insurance companies. So it's been interesting watching different Western democratic countries legislate that you can't use genetic information to set insurance costs. Okay. Now there's a couple of ways this could go. One way is, as the genetic information comes up, people find ways of discriminating against you. Mm-hmm. That's one future. The other future is they're not allowed to discriminate against you, but you now know things about your insurance risks that make you go for insurance or not go for insurance. That makes insurance not possible to get. If only the people who know they're going to have something go bad get insured, and the ones who know they won't get anything bad don't pay, then the insurance system collapses, right?
Yeah.
I don't know what's going to happen, but as to your question, it's complicated, right? But I would just say, in general, the more information you understand about your health, the more you can do for yourself. And the whole point of the company is, in the same way that nurse taught me how to inject myself, all of us can do something to look after ourselves.
Yeah, interesting. That particular question, I'm sure will run and run.
Yes.
Maybe I'll invite you back in a few months' time, and we'll have to get a doctor of philosophy and a doctor of ethics back as well.
I'd really enjoy that, actually.
Join the discussion. Yeah, I think I might as well. One final thing. So this started off with your experience within the NHS, but is the rest of the world's kind of health systems as fragmented and infuriating as they are here?
Yes, and the reason for it is that all the miracles, all the advances in modern medicine come from specialization. So a doctor becomes a surgeon, becomes a heart surgeon, becomes a children's heart surgeon, right? The thing is, when they specialize, they know more and more about less and less of you. And that's the same in every healthcare system. That's what leads to this infuriating, I've got something wrong with my heart and I've got something wrong with my gout. And these two doctors don't know what the other one's doing, and they won't coordinate what they're doing. Mm-hmm. Now, when I started, my research was in the States, and it was all about, seeing what Google and Microsoft and others were trying to do. Everyone should do this. And I spent a year after writing my book begging US hospital systems to do this because it was so obviously good for the patient. But I then decided US was uniquely bad at solving this problem, because fundamentally they'd say, why would I give my customer's data, that's your medical record, to my competitor? That's when you go to the other hospital. Mm-hmm. So all of them were trying to lock you up to lock in your revenues. Whereas the NHS had the opposite business model, where they had to look after Mike for decades. And so if Mike could have his information and not go to a hospital, that would be good for the NHS. So I thought everywhere is very difficult because of the healthcare system's fragmentation. But the US has a financial problem that makes it even harder. And the NHS has a financial instruction that should make it easier. I will say I thought it would make it easy. It wasn't easy, but it was easier in the UK. And now we operate in other countries like Ireland, the Netherlands, Nigeria. We're just about to start in Canada. You see these problems everywhere in every healthcare system.
Goodness me. All right. So it means, I guess what this means really is you will never actually ever be finished, will you?
Well,
you're never going to be able to sit down and go, I've done it now.
Grasshopper, so. but yes, so we're never finished. But on the other hand, every day you're fixing more things for more people. And you can just see the benefits for people as a result.
Yeah. So, I mean, this whole problem, this whole method of solving it is fascinating, really. And the good it can do is just, I'm thinking blindingly obvious, really. Hopefully other people think, right, this is worth getting on board and
Yes.
on board with, and and people press the message enabled button on the thing, so it's
Yes.
a lot easier, for it all to work. But if people are listening to this and they want to find out more, just register themselves as a patient or just find out more about how it all works, what should they do?
Go to patientsnowbest.com/register. Click there, just login button, off you go. Also, get your relatives to register as well. So, for example, getting my parents to register so that even if I'm not living in the same place as them, after they've registered, they give me access, and then I can see what they're doing with their doctor and help them out with advice.
Right.
Or I could give other people access to my records so that when I need help in A&E, my family members can step in and help out as well.
Sure.
But it's all on patientsnowbest.com/register. It's all free.
All right. Well, look, again, thank you so much, Mo, for taking the time to chat.
I've really
Really
enjoyed it,
interesting. Good luck with it all. As I say, you'll never be finished, but good luck with the progress you're making. And thanks again
Yes.
for taking the time to chat.
Thank you, Mike. Really appreciate it.
Thank you very much to my guest this week, and that was Dr. Mo talking about his method of getting people's health information in one place called Patients Know Best. Some of you may have noticed that he's read my book, which is called Cut the Crap, Ask the Questions That Matter About Your Health. So he's read the book, and you can as well. You can find it on Amazon. It's based on many of the guests that I've had previously on the show, and it encourages the reader to ask questions about their own health. Thank you for listening today, and have a healthy week. Until next week.
Thanks for listening to the Relax Back UK show. Join me, Mike Dilk, again next week for more fascinating interviews and chat. If you're listening to the podcast version, please subscribe, like, and share it with your family and friends. And have a healthy week. Until next week.